When it comes to vaginal health, one of the most common concerns is odor. Many people wonder, does my vagina smell normal? It's a question that can cause anxiety and embarrassment. But the truth is, vaginal odor is a natural part of life. The vagina is a complex and self-cleaning organ, and its scent can vary from day to day for many reasons. Understanding what's normal, what isn't, and how to respond to changes in odor is an important part of self-care and sexual health. First, it's important to know that every vagina has a unique scent. This natural odor is influenced by many factors, including your menstrual cycle, hygiene habits, diet, exercise, and even the types of clothing you wear. A healthy vagina typically has a mild, musky, or slightly tangy smell. This is normal and nothing to be ashamed of. However, there are times when changes in odor may signal something more, such as an infection or other health issue. Let's explore what causes vaginal odors, the difference between normal and abnormal smells, and what you can do if you notice a change. We'll also discuss common conditions like thrush, bacterial vaginosis, and sexually transmitted infections, STIs, all of which can sometimes cause changes in vaginal discharge and odor. So, what is considered a normal vaginal odor? The vagina maintains an acidic environment by producing healthy bacteria, mainly lactobacilli, which help protect against infection. This environment naturally creates a mild scent. Throughout your menstrual cycle, slight changes in odor may occur. For example, after your period, you might notice a stronger or metallic scent due to blood. After sex, the odor may also change temporarily because of semen's alkaline nature. Exercise, sweat, and even diet, especially foods like garlic, onions, or certain spices, can influence your body's scent, including that of your vagina. But when should you worry? A change in vaginal odor, especially if it's strong, fishy, or unpleasant, could be a sign of an underlying condition. If the odor comes with other symptoms, such as itching, burning, abnormal discharge, pain, or irritation, it's a good idea to consult a healthcare provider. Let's look at some of the most common causes of abnormal vaginal odor and what you can do about them. One of the leading causes is bacterial vaginosis, often referred to as BV. BV occurs when there's an imbalance in the normal bacteria in the vagina. Instead of healthy lactobacilli, other types of bacteria overgrow. This can cause a thin, grayish-white discharge with a strong, fishy smell, especially after sex. BV isn't considered a sexually transmitted infection, but sexual activity can increase your risk of developing it. Other risk factors include douching, using scented products near the vagina, and having a new or multiple sexual partners. If you suspect you have BV, it's important to see a healthcare professional. BV is usually treated with antibiotics, either as oral medication or vaginal creams. After treatment, most people notice that their odor and discharge return to normal. To help prevent BV, avoid douching and scented hygiene products, wear breathable cotton underwear, and practice good hygiene. Another common condition is thrush, also known as a yeast infection. Thrush is caused by an overgrowth of Candida, a type of yeast that's normally present in small amounts in the vagina. Unlike BV, thrush isn't usually associated with a strong odor. Instead, it causes thick, white, cottage cheese-like discharge, intense itching, redness, and discomfort. If there is any odor, it's usually mild and yeasty rather than fishy. Thrush can be triggered by antibiotics, hormonal changes, diabetes, or a weakened immune system. Treatment for thrush usually involves antifungal medications, which can be taken as tablets or applied as creams or pessaries inside the vagina. Over-the-counter options are available, but it's always wise to check with a healthcare provider if you're unsure. To help prevent thrush, wear loose-fitting, breathable underwear, avoid unnecessary antibiotics, and limit the use of perfumed products around the genital area. Sexually transmitted infections, or STIs, can also cause changes in vaginal odor and discharge. Some STIs, such as trichomoniasis, chlamydia, or gonorrhea, may have few symptoms at first, but can lead to unusual smells, increased discharge, and discomfort. Trichomoniasis, for example, often causes a frothy yellow-green discharge with a strong, unpleasant odor. STIs can have serious health consequences if left untreated, including pelvic inflammatory disease and infertility. If you think you may have an STI, or if you have new or concerning symptoms, it's important to get tested and treated as soon as possible. Many STIs can be easily cured with antibiotics or other medications, but early detection is key. Practicing safer sex, including using condoms or dental dams, can help reduce your risk of contracting or spreading STIs. There are also non-infectious factors that can cause vaginal odor. Poor hygiene, for instance, can lead to the buildup of sweat, bacteria, and dead skin cells, which may cause an unpleasant smell. On the other hand, overwashing or using harsh soaps can disrupt the natural pH of the vagina, leading to irritation or infections. The best approach is gentle cleansing of the external genital area with warm water and, if needed, mild unscented Yeast. Hormonal changes can also influence vaginal odor. During pregnancy, menopause, or while using hormonal contraceptives, shifts in hormone levels can affect the balance of bacteria and the amount or consistency of vaginal discharge. These changes are usually temporary, but should be discussed with your healthcare provider if they are accompanied by other symptoms. It's also important to consider lifestyle factors. Wearing tight clothing, especially non-breathable fabrics like nylon or spandex, can trap heat and moisture, creating a favorable environment for bacteria and yeast. Opt for cotton underwear and loose-fitting clothes whenever possible, and change out of sweaty workout gear promptly. Diet can play a role too. Certain foods, such as garlic, onions, or asparagus, can cause body odors, including those from the vagina. Drinking plenty of water and maintaining a balanced diet rich in fruits, vegetables, and whole grains can help support overall vaginal health. If you're concerned about vaginal odor, there are a few simple steps you can take. 1. Practice good hygiene. Wash the external genital area with warm water daily. Avoid douching, as it disrupts the natural balance of bacteria. 2. Wear breathable clothing, choose cotton underwear, and avoid staying in damp clothes, like swimsuits or workout gear, for extended periods. 3. Avoid scented products. Skip perfumed sprays, powders, and wipes near the vagina, as these can cause irritation or allergic reactions. 4. Observe your body. Pay attention to changes in discharge, odor, or other symptoms. Track your menstrual cycle, as this can help you notice what's normal for you. 5. Practice safer sex. Use condoms or dental dams with new or multiple partners, and get regular checkups for STIs. 6. Seek medical advice. If you notice a persistent change in odor, abnormal discharge, pain, itching, or burning, don't hesitate to see a healthcare provider. Early diagnosis and treatment can prevent complications. It's vital to remember that the vagina is a self-cleaning organ. Internal cleaning is not necessary. Your body is designed to maintain its own healthy environment. Overuse of cleaning products or frequent douching can actually increase your risk of infections like BV and thrush. In summary, a mild, musky scent is completely normal for a healthy vagina. Temporary changes in odor can be due to your period, sex, exercise, or diet. However, persistent or strong odors, especially if accompanied by unusual discharge, itching, burning, or discomfort, may signal an infection or other health issue that requires attention. Common causes include bacterial vaginosis, thrush, and sexually transmitted infections, all of which can be diagnosed and treated by a healthcare professional. Taking care of your vaginal health means being aware of your body, understanding what's normal for you, and not being afraid to seek help if something feels off. There's no shame in wanting to know more about your body or in asking for medical advice. Remember, you're not alone. Vaginal odor is a topic that many people wonder about, and getting the facts is the first step to feeling confident and healthy.